This week at the vet, Jupiter and Neptune are in for their castration. Mycozil came in for microchip and vaccination, and one dog was put down. First in are Jupiter and Neptune for their castration.
Oh, the treatment has been very good since I brought them here. Dr. Jalloh has been following up and they are doing very well. Now they are old enough to be castrated, so that's why they are here. Yes, and then maybe I noticed they were doing some other things. They were like digging the soil, and I thought because there are times when dogs do things like that, it's like they lack some vitamins. So I spoke to Dr. Jalloh, and he told me I should come with them so they could be treated. So that's why we're here. No, this is Bobo Day. Hello. Then this Bobo women camp, then for camp them.
Now yeah, we can put them kids then, or they do such things, so always before always be stay. So now make the carry for this effect.
Jupiter and Neptune are about to go in for their castration. The team prepare for the operation. One of the dogs puts up a fight before they can inject. The owner comes in to comfort them.
How they kind of find
So then for sleep with the injection? Ah, okay. Oh my God.
Very nice pet owner. So it's the owner that makes the pet to be a good dog. You see, within a short period, you've seen them how they were initially. Very tiny. Nobody would like to have them, like stray dogs. But it has made them to become very good dogs. So that's all what we can say. It is you that makes your pet to be a good pet. Don't look for a good dog, be a good dog owner.
preparing this dog for castration. So presently, he's under anesthetic.
Jupiter and Neptune are about to go in for their castration.
Yes.
The team has just finished castrating a female dog. First in is Jupiter for his operation.
Male dog. Well, for the male, we remove the testes. For the female now, you have to open up, remove the ovaries. So that's the difference. With the male, just the testes you remove. Tie the spermatic cord, then you cut, you pull the 2 testes. For the female now, you remove the uterus and the ovaries. So that's the difference. So the female surgery is more difficult than the male. The male is like 3 minutes, you are done, but for the female, sometimes you go up to an hour, depending there is no bleeding, no complication along the surgery.
What makes a good pet trial is not the pet itself, not the breed of the dog, but whether the pet owner is him or herself that makes the dog to be what it is.
Next in is Mykozir, the cat to be microchip, ready to travel to Serbia.
You will be at the movie.
How old is this cat?
2.5 months.
Okay.
But she eats like an elephant.
2.5 months.
Blood sample. Because we'll spend 2 days in Paris. How many days?
Up to 5 days.
Up to 5 days. Okay.
We'll keep it within the refrigerator. But we'll make a serum, not the not the blood.
Okay.
We'll make serum out of it. So from the serum, that can take care of up to 5 days. Because now we have to identify a laboratory, either in Paris or in Serbia, where you will take the blood. They will analyze it. After analysis of the blood, they will send it back to us.
Okay.
Then we got a positive result. From then, we can now travel with the cat. 3 months from that day, you get a very good result. So basically,
Okay.
that's the way it works.
Okay, so once we get results, we can travel within 3 months.
Yes,
Okay.
after 3 months. Today you do 2 things. Today I'm doing microchip
Okay.
and vaccination.
Okay.
Normally, the rule is you microchip first, then you vaccinate.
Okay.
Then
But
from
we
the-
can do that today, both of them.
Yeah.
Okay.
You just go to Europe, under Europe,
Yes.
entry requirement for EU with pets. Pet entry requirement in the EU. So you will get there, they will direct you with laboratory. You look the best laboratory that suits you most, they can go to it, whether it's France
Or Serbia.
or Serbia,
Yes.
whichever.
Put a smile to be nice.
You're going to help by you.
Chip.
Okay, we have to check.
The chip is planted properly, huh?
Yes.
Dr. Jalloh gets the machine which will implant the microchip.
Okay. Okay, there.
Okay. We have a number. You will put it number somewhere.
The numbers are here. We just want to make sure that what we have here is what is here.
If she goes somewhere, we will find her before somebody eats
Yeah,
her.
yeah. You can register this number to a company that will help you to trace this cat in case it is missing. That's the importance of this one. You know, guys. Did you get it as a baby or?
She was baby, little baby, maybe 2 weeks.
Okay, good. Well, we can do it now. Give me a needle.
Meow meow.
Some of them
Okay, let me move.
Okay.
Okay.
The owner receives a card as evidence of the vaccination the cat has received.
Whether there will be some reaction to this vaccine?
Well, I will never say no, but it has not happened yet in my person.
Okay.
It's quite possible it can happen,
Yeah.
but not yet. I've not experienced it yet.
Okay.
Hopefully I will not
Okay.
from your cat.
Good.
Okay, good. Okay, thank you. We had a cat which is we are preparing to travel abroad. I'm not very sure of the country, but I've asked them to get the details. For that one, there's a prerequisite to travel with any pets. We have to have the animal vaccinated, do some rabies titration to make sure that this animal is free of rabies. We have to take the blood, send it to a laboratory in Europe. They can do the analysis. After the analysis, the dog can travel.
Neptune is next in for his operation.
So this dog, we are finished doing the castration. So it's about to recover from the anesthetic.
Finish with the surgery. We give injectable like painkiller, antibiotics, then we take her out for recovery of anesthetic. But sometimes some will yell, some will just be quiet. No, different dog with different behavior.
Neptune has now finished. Buster and Damien are next together. Buster has an ear problem and Damien comes for his booster shot.
The get problem is the boot of see we get so inside it. It's useful to be our security dog.
Buster is about waiting for his ear to play.
Damien, go get booster shot.
Buster's ear is damaged. It takes a long time to clean. Damien has finished his treatment and now he is going home in the rain. Next in is Maggie, who has lump on her back.
She's here because she has a little lump on her back. I want to see what it is with the doctor today. I love Maggie because she's a small dog. She doesn't grow up too much and she's fun. And she's got her crazy eyes. Well, what's he warning me at this ball? Okay.
Teddy is going to draw out some of the liquid in the lump to test.
Because there are times if you open them up, but not at this stage.
Yeah.
So this will not going to open now.
Okay.
So wait like the next 1 week, you see her.
Okay.
So when I go now, no sign of the expert.
I got a machine then, no problem. Maggie is 6 months? Yeah, 6 months old. She's been here in this country now with us for 4 months, and you know, she's adapting well. And we try to get the help of the doctors here whenever there's any questions. Because it's the first dog that I own, so I don't understand dogs very well. First time she had worms infection. They came, they gave me the meds, and now she's okay. And today we brought her just for a little lump she had on her back, which they just tested now. It came out it was a little bit of pus. Maybe she got, maybe something stabbed her and left an infection. And he says we have to come back next week just to withdraw and drain the liquid.
Teddy and Zainab attended a rabies workshop.
How to get this rabies this infection? How to get out?
Through animal bites, especially dog then common.
Not only dog, but why the fasting dog?
Through your hand.
Because we can always die around human being.
Yes, doctor.
Yes, ma'am.
No, I just want to add something to this
Animal.
animal. Animal. We possibly get rabies, not only by bite.
Yes.
If you get a broken skin back, you get wound.
Mm-hmm.
The that affected animal saliva go inside it. Tendency back you can get.
So that is good. Rabies, it can be transmitted or it will pass on to person through food.
Some dog then they way as you sit also in the mouth. In tongue do all in a do then you get saliva. Small picking sit out in food, it eat. That's saliva they do come around picking in food. Tendency they for like if you say if that dog will get rabies, that's saliva they do come around picking in food. There's a tendency to make people become affected.
If the dog get rabies, drop like the guy, put an eye, they go get her. They go through yara to the brain, so within 1 week that begin they will show some signs of rabies.
I mean, I think after we don't wash them, you get for, well, I don't know when you do test, but you get for test for know whether the dog will bet you. Now, you get the.
Very good, thank you.
The second thing, now for put something we will stop. The soap, the work, you can use the toy, you can use iodine, you can put salt, or you put lime. You know they just wash your normal milk. You find when you wash them, you squeeze like more blood come out in case some you don't go inside like the virus reduced in the body. They tie, if not like here, they tie up here so that the thing will go fast. Then you run go to the health center. That will get that clear. That's the first stage.
But the second point, for proof say this is not rabbit or not rabbit, what if you do?
You therefore hold the dog, you put am at a place, outside you observe am for a period of a time. If the dog acting a 10 days period, if the dog na rabies dog, you see how he become wild. You observe him because he get to feed them well.
Back at the vet, Leon has come in for a wash. Leon is no stranger to the vet.
Well, this dog that you've just seen here, he was here when he was very small. So we looked after the dog because the owner went out for holiday. So he's kind of attached to us. That's why when he saw me, he was just trying to jump back to me. So he's been here all the time. And I should say he grew up here. These are all his friends, so he needs to just walk around. Leon, he's called Leon. He's one of our best friends here. I know. Hey, stay back. Come. Leon, come. What's your problem? Come.
Leon, go.
Come. He knows everything. I don't need to carry you, Leon. I'm tired of this. No, he's here for his routine medical wash. That means we have to deflea, to wash Leon with the shampoo that will kill most of the fleas. And also to repeat is ivermectin. That's an injection for mange, because it's not a one-off treatment. He has to come as often to make sure we keep the mites in a manageable size under the skin, because no sooner they go beyond the amount, then you start to see something like mange, because they cause a lot of havoc underneath the skin. So you see he's scratching, and that can tells us that he has fleas, and you know he's always going out for walk, and then he can pick up some of these fleas there. So it's difficult to get them off fleas. Leon, come.
Last in is a dog with hematoma, whose owner wants him put down.
He has hematoma. As you can see, the ear is swollen. It means blood is leaking. There is a ruptured vessel. So you find out that there are a lot of blood inside the ear. So unfortunately, the owner said we should euthanize the dog. But I tried to talk him through that. The dog have a chance to recover and all because of the skin, but insisted that they could not handle the dog normally, like developing that bond that they could wash, do normal treatment for the dog or normal routine like the other dogs. So we're going to euthanize the dog, which means to put the dog. Humane way to put the dog down. So there is a protocol. We have to give the anesthetic, make sure the animal is completely sedated, and then we can get the uterine direct into the heart, and then that's how it goes. So just giving the anesthetic.